Here we go. There we go. Ah, there it's working. Hey, it's a day. It's a new year. It's 2021. 2020 is over. 2021 is perfect. There's nothing that's going to happen in 2021 that's going to upset anyone.
From your
Oh,
lips to God's ears.
I have good
think
news.
you're already wrong.
Well, it's kind of what I told my kids. I said, be careful. Yeah. In my life, whenever someone's really excited about something coming, that's when I get very nervous. Yeah. Like, 2020 is over. It's going to only be good stuff now. Here we go. God bless it. And, today we have a fun one today, actually. Yeah. So here we go. You're going to teach
You
me.
don't know your own topic?
Well, when I was preparing for my email on Sunday and, for the tough questions, this Teshuvah that we're going to be studying today just came out. It was approved on January 1st to understand, how new this is. So I had someone say to me yesterday something to the effect of, have you read it? I said, I'm teaching it tomorrow because it hasn't really broken. This, most people have not seen this yet. So, and I haven't seen,
Rabbi, did you decide on this topic before the tshuva was out?
No. I decided on this when I saw this Teshuvah came out. I think Teshuvot, which I'm about to explain now officially, are something we should know about. The seminary, the movement puts out laws that no one ever sees or hears. And I thought maybe we'll study it. But unfortunately, it's 10 pages long. I got to fit it into a 30-minute period so we have time to fight. And so we're going to get started. Unlike usual, we're going to get started. I'm going to reward. This is different for Bethel. I'm going to reward those who show up on time. So here we go.
This should be noted in the poll.
That's it. And for the first time ever, actually, if I keep saying it, I'm going to pass the minute. Here it goes. Mute all. Okay, here it goes. You're all muted. All right. You will be able to unmute yourselves. I am going to I'm going to use the chat a lot today. I'm going to do some different things today because we have never done this where we study a tshuva, a law. But I'm going to put some quotes into the chat box while we're going, which means that it's going to get a little more interesting because I have to kind of go back and forth. But if I keep introducing, I'll never get to the topic. So here it goes. Welcome. Let's see. Recording. Good. Welcome to Tough Questions. This is January 7th, 2021. 2020 is over. 2021 is here. It's all quiet, right? Okay. And we are going to study today a teshuvah, a law, the way the conservative movement works for the last 100 years. You have a question that has not been answered in the Torah or the Talmud or the Shulchan Aruch, and you say, what's the answer? So you write a letter to the CJLS, the Committee on Jewish Law and Standards, like 25 rabbis. They sit there and they accomplish very little. And but every now and then they put a law out, a teshuvah. Teshuvah means answer. A she'ela is a question. A teshuvah is an answer. And here, I'm going to go to, I'll go to Spotlight View. Fine. Okay. But I'm going to stick to Gallery View on my own. And so they put out a teshuvah, and they probably put out 3, 4, 5 a year kind of thing. And you get a little summary of it. But this one came out on January 1st. They probably put it out on January 2nd to the real world. And then as I'm preparing for this coming week, I see this teshuvah. This is the CJLS, Committee on Jewish Law and Standards of the Conservative Movement. It is a teshuvah from Rabbi Michael Peltz. He's the one who wrote this, but they vote on it. It is entitled Vaccination and Ethical Questions Posed by COVID-19 Vaccines. There's a lot of questions. I even got a great one today. Approved on January 1st, 2021. All right, so they voted on New Year's Day by a vote of 18-0, which is unheard of, in the conservative movement or in any Jewish organization in 3,000 years, 18-0. And not even an abstention. Everyone who voted for it. I've never seen it before. And here's the question. So the question and the teshuvah, the answer. The question, now that vaccines for COVID-19, here, I'm going to do it this way. Okay. I promise to use more chat. If you don't know how to see a chat, I'm reading it to you anyway, but it goes like this. Okay. I got it. Okay. I'll get faster at this too. Okay. And I'm going to get rid of participants so I can see the full chat. Now that this is the question. It probably, but Harvey, now that vaccines are for COVID-19 are available, is there an obligation to be vaccinated? Must you get vaccinated, right? That's one of the questions floating around out there. Can Jewish institutions require vaccination for employees, students, and congregants? Yeah, at some point, can you have a service and say, if you don't have your card, you're not allowed in the synagogue? What should be the guidelines for distribution? Should I get it first? Should it be who pays for it? Some great questions. I'm old. I got a bad heart, whatever. Are there guidelines? And there are. Here it goes. Here is the response. Let me throw you some Torah. Okay. Here comes Torah. Okay, here we go. Torah, Deuteronomy chapter 4, verse 9. Not very interesting, but it's the beginning. Okay, here we go. Okay, here we go. First Torah quote. Torah, Deuteronomy chapter 4, 9. Be careful and watch yourselves. Take care of yourself. That's part of Jewish law. Pikuach nefesh, save a life, protect a life. Take care of yourself. Here's another quote if you don't get it yet. Okay, the Talmud, the Jewish book of law, 2,000 years ago. Okay, Brachot. Here we go. 32b, avoid danger when possible. Okay, yeah. One of the, like someone will say, is smoking against Jewish law? You could claim, even though you might know a lot of Orthodox Jews who smoke, you could claim that smoking is against Jewish law because it puts your life in danger. And there is a question of how much danger the rabbis asked 2,000 years ago. By the way, if you're new to me, you don't worry because you'll have a chance to attack me later. But I go for the first 30 minutes ish. Here we go. Deuteronomy chapter 22, verse 8. Here we go. This is a famous one. I use it a lot. Okay. Deuteronomy 22:8. That's not the quote. If you're building a house, and houses back then had flat roofs, you must build a parapet, a guardrail around one's roof. Not for yourself, but for others. You must protect others from themselves, is one of the Jewish ideas. So back in the old days, we used to debate like motorcycle helmets. We're going to impose on you to wear a motorcycle helmet. That is Jewish law. If I see a bunch of children playing around an old refrigerator, as the old story goes, you don't know what it was like in the old days, but old refrigerators locked on the outside, locked on the inside, you couldn't get out. So if you see the children, even though they're not your children and not your refrigerator, you have an obligation to protect someone from themselves. An open manhole, you must protect someone from themselves. You are obligated to protect others from themselves. In this world we live in today, these questions are more come to us a lot. Okay, I'm going to keep on going. Okay, some more quotes, and then I'm going to go off the quote machine. A couple more before I go off the quote machine. Rabbi Moshe Isserles. He's one of my favorite rabbis. I've got a lot. Rabbi Moshe Isserles is the comment on the Shulchan Aruch. He's the Ashkenazic, he's called the Ramah. Rabbi Moshe Isserles, Shulchan Aruch, 500 years ago. One should avoid all things that endanger oneself. Right? If you're not getting it yet, as we treat physical dangers more stringently than ritual prohibitions. Okay, keeping kosher, Shabbat, blah, blah, blah. If life is at stake, throw it all away. Physical dangers are much more important than ritual prohibitions. There were stories that in the old days, before they had any other choice, they might have to make you eat bacon because you need something, I don't know, anemia or something, and that would overrule. You would command it to eat bacon. Nowadays you can have a pill, but in the old, you could actually argue you have to eat bacon for the protection of physical danger. Okay, one more quote before I go off my quote, parade. Okay, copy Torah. One last part. I think you've heard this one before because it may be the most often quoted source in rabbi history. Leviticus chapter 19, verse 16. Do not stand idly by the blood of your neighbor. Right? If you see something, say something. There's no such thing as an innocent bystander. If you see something and do nothing, you are guilty. You're not innocent if you're a bystander. If you're standing by, you are guilty. Do not stand idly by the blood of your neighbor. Okay, that is my quote train for a moment. We are supposed to safeguard the health of others. We must take preventative measures during the pandemic. We're going back into the tshuva. We must take preventative measures during a pandemic, like wearing masks. According to Jewish law, you must wear a mask. You must wash your hands. You must maintain physical distancing. These are not just recommended, not just a nice thing. It is obligated, commanded by halacha, Jewish law, to wear a mask, wash hands, physical distance. Vaccines have the same answer. Vaccines have the same answer. And we've seen, it's not the first time we've talked about vaccines. Well, in Jewish history, in 2005, the CJLS, the Committee on Jewish Law and Standards, the Jewish law component of the conservative movement, wrote a teshuvah, Rabbi Joseph Prauser, talking about, you're going to like this one, especially if you're anti-vaccine. Okay, don't forget there are people who are anti-vaccine, so please try not to offend each other. But this is Jewish law. Compulsory immunization in Jewish day schools. This came up front of the conservative movement. Can you kick a kid out who's not vaccinated from your Jewish day school? Here it goes. The question, whether Jewish day schools could grant an exemption on religious grounds for a child whose parents refuse to permit vaccinations. I will put the answer to that law into the chat. I'm sure you could probably guess what the answer is, but just in case, I will take that quote, stick it into the chat, and here it goes. What is the conclusion? They concluded, failure to immunize children against vaccine preventable disease is a serious compound violation of Jewish law. There is no basis in halakha, Jewish law, to support a parent's request for a religious exemption from state-mandated immunizations. And so the conservative movement said that you can keep non-immunized children from going to your Jewish day schools. This then becomes, the next step is they move this to adults. Vaccination mitzvah, commandment for adults as well. Rabbi Elliot Dorff, who was one of my teachers, he was the dean of my rabbinical school in California. He's the head of the law committee of the conservative movement now. Great guy, nice guy, hard teacher. He wrote a book, and the book is called Matters of Life and Death. And here is his take. All right. And he speaks for the movement a lot. Okay, here we go. All right, there we go. Here is his take when he brings adults and children together. This is Rabbi Elliot Dorff, the head of the law committee. With its strong sense of community and duty, the Jewish tradition would have us use communal measures to preserve our lives and health as much as possible. It would be a violation of Jewish law, for example, for a Jew to refuse to be inoculated against the disease, at least where the inoculation has a proven track record of effectiveness. That's important for the tshuva we're about to study, that we're studying. A proven track record of effectiveness. Jews, on the contrary, have a positive duty. You must do commandment. It's a yes commandment. To have themselves and their children inoculated against all diseases where that preventative measure is effective and available. This is going to lead to a question in today's issue about, is today's vaccination, is that a proven track record when it's so quick? So the obligation, according to Jewish law and the conservative movement, is to be vaccinated against COVID-19. And it's obligatory when the inoculation has a proven track record of effectiveness. So the question is it a statistically recognizable risk to have it or to not have it? And the answer that this tshuva that came out on 7 days ago was it's still a generally very small risk. And the benefit to health and of the individual and to society, which is even more important in Jewish law, takes precedence. Are we hurting others? The known and potential benefits of a drug must outweigh the known potential risks. So there are benefits and there are risks. There's always going to be risks, but the benefits outweigh the risks. And what about this fast track vaccine? For those of us who study history, we know that what we're witnessing right now with this vaccine is historic, right? How fast they got it out, right? There were a lot of problems with the smallpox vaccine, which is actually the next topic. And what about a fast track vaccine? Are we still required? So let's go back to the early 1900s, the turn of the century, smallpox. Let's go right there. There were Jewish sources. The Jews have been around even during the smallpox vaccine. Smallpox vaccine, the turn of the 19th century, Rabbi Israel Lifshitz says there's an infinitesimal risk when you get a vaccine, which he described as 1 in 1,000. So if you have 1 in 1,000, right, or less of chance of, dying, because there's always going to be a chance, 1 in 1,000, it is appropriate against the much greater risk of contracting the illness. So that not 1 in 10, not at 1 in a million, 1 in 1,000. The real risk of contracting COVID-19, back to the tshuva, over presumed risk of a vaccine approved under an emergency process. So here we go. We say that the risk is less than the presumed risk of the vaccine is less than contracting COVID-19, a much higher one. Abraham ben Solomon of Hamburg, known as Abraham Nanzig of London, in 1785. Okay, this is written in 1785. Okay. Here we go. Let me give you a 1785 answer. Okay, give me a second. I'm talking fast because I'm getting a 10-page teshuva done in 30 minutes. Okay, copy. And then I have a national rabbi meeting in 45 minutes, and that's why I had to move our class up. So here it goes, 9, paste. Good. Okay, smallpox inoculation. And before you read on your little square, unless you're cheating, smallpox was a leading cause of death in Europe in the 18th century. Smallpox was the #1 cause of death, where an estimated 400,000 people died annually. Every year, 400,000 people died of smallpox. Therefore, and now into your chat box, what did 1785 Rabbi Abraham Nanzig say? Smallpox is so widespread and so contagious that everyone should be considered at risk, not just those at risk, everyone's at risk. And therefore, the benefit of the vaccine, even when that is new, fast track vaccine, this is 1785, by the way, and without a long track record, as Jenner's vaccine was the fast track vaccine at the time, outweighs that risk. So even a fast track vaccine, which scares me a little, is according to Jewish law. And by the way, studying for this class has really pushed me over the edge. I completely agree. From studying, that's why I studied Tshuvot. It kind of, when I even think for a second, Tshuvot helped me. So outweighs that risk. There is a greater societal benefit of taking the vaccine, along with the serious consequences of contracting the disease. And that outweighs the risk it might pose to a few individuals. What happens is Jewish law places a responsibility on each of us to take preventative measures, such as wearing masks, limiting gatherings, and frequent hand washing. This responsibility would also extend to being inoculated against the coronavirus. What about the Orthodox? Just in case you're wondering, I'm only conservative. The Orthodox Union and the RCA, which is like almost the Lubavitch Orthodox Union, have also ruled that it is a requirement to be vaccinated for COVID-19. You can't say I'm Orthodox and therefore you can't use Judaism as an excuse. You want to use another one, God bless you. But you cannot use Judaism. Conservative, Reform, Orthodox all agree you are commanded to be vaccinated. So let's go to the second part of this tshuva. Can we require vaccinations for employees? You'll be fired. Students, you can't be in our schools, or congregants can't come to services. Here it goes. Let's talk about these students of Jewish day schools. I didn't show you the final answer here, and that's coming into your chat box in a second. Okay, and here's the conclusion on Jewish day schools. Here we go. Yes, I forgot to breathe there. That was my brush. Okay. So if you send me a message, I probably can't read it because I'm on a roll. Concludes, unless a specific immunization is medically contradicted. And so documented by reliable physicians. So your doctor write your note, says you must not do it or you'll die. Unvaccinated children, even those who in violation of Jewish law have secured a religious or philosophical exemption from the state. I have a letter saying right? How many times do we see the state allows me to do something? That doesn't mean you can do it. Are properly denied admission to Jewish day schools. The final answer on this Jewish day school question. Any Jewish institution, the tshuva continues, any Jewish institution requiring vaccination, any Jewish institution should require vaccination against COVID-19 for its participants, whether they be employees, students, or congregants. Now, remember, I didn't say this. When I read you a tshuva, in the conservative movement, I don't know if anyone has ever studied Tshuvot before. It is a viable option in the conservative movement. Not all synagogues are going to follow every word of every tshuva because there's always another tshuva to say something else. But this is the tshuva that has come out so far. There'll be more, but this is a viable option in the conservative movement. So will every Jewish institution follow what I just read because a tshuva said it, even 18-0? No. I can guarantee there are synagogues that don't, just like there are synagogues that have one day Yom Tov, and there are synagogues that serve gelatin, and there are synagogues that, they don't serve pork. That's a no-no. So the tshuva says you shouldn't let anyone in who doesn't vaccinate. So what are the Jewish ethics of distribution? The next part of the tshuva. There's distribution issues, ethically speaking. So here it goes. I'm going to give you the 3 levels of problems with distribution. Here we go. 3 different levels of vaccine distribution issues. It's a big tshuva. I mean, that they got it done in 10 pages, I think is a record for the conservative movement. I mean, they make 45-page, ones. Oh, you didn't see it. Oh, because here, wait a second. Let me fix something. It's too late now. If you send me a message, all of a sudden you get the responses of everyone else. Please try not to send me a message during this while I'm talking. It's going to throw off everything. Okay, so that's why you didn't read what I was reading, because it went to one person. Here it goes. There are 3 different levels of vaccine distribution issues: global, national, and personal. Global. What obligations, if any, do rich countries have to poor countries in sharing the vaccine, right? I keep on getting the news from Israel and from Germany and America, and they're stockpiling this vaccine for their people, right? You can afford it, buy it. What about on a national level? Within a country, how do we decide who gets it first? The frontline workers, the doctors, the lawyers, the person who passes it around. What about prisons? It gets passed around a lot there. And then personal. As individuals, do we each have an obligation to wait our turn? Right? They talk about the NBA, the basketball players. There may have been a way for them to pay and get moved up because they're basketball players and they're mixing with each other. Or are there circumstances where one could jump the line? I was asked that question today by a congregant. They have an opportunity to have a vaccine for some money. All right. So what do you do? Here it goes. Let me give you a couple quotes. All right. There we go. That's it. Here we go. Talmud. Copy. Okay. Going to everyone. Talmud. 2,000 years ago, Nidarim 28a, Dina Damalchut Dina. Don Selleck, God bless his soul, would always quote this on Wednesday. The law of the land is the law. We follow the law of the land. It overrules. If the law says do something, we can say, well, Jewish law says something else, unless it's telling us to break. If the law says murder someone, then we could say no. But you can't say, I'm going to give my child alcohol because he's an adult at 13 when American law says 21. That is a no-no. You are breaking the law of the land. March 20th, March 2020. So not so long ago. Here, this was, remember in Italy, they were trying to decide who gets a ventilator. Here it goes. Who gets a ventilator? Who gets the vaccine? These are similar answers. March 2020, CJLS, the law committee, approved 2 to vote. Rabbi Dorf, who is the head of the law committee, and Rabbi Nevins, who is the dean of the JTS, another rabbi I know. And they were talking about triage during a pandemic. Who do you treat first? Think of a MASH. Triage. Who do you treat first? Allocating ventilators during a pandemic. So, number 1, who is in the most immediate and grave danger? Jewish law differentiates between brief survival, chayei sha'ah, you're going to live at that moment, and long-term recovery, chayei olam, with a year of survival as the criterion. So, yeah, who do you save? If someone is going to live just for a couple more days, or you can save someone that can live longer, you may, even though it's at that moment, you may save the person who has more days to live afterwards. Who is in the most immediate and grave danger? Prioritizes healthcare personnel who are working with COVID-19 patients and residents of long-term care facilities who tend to be more vulnerable to the spread and severe consequences of the virus. So the ruling in March 2020 was long-term care facilities, the vulnerable should come first. The vulnerable should come first. And there are 4 moral principles to guide triage decisions. Here's your next quote. It's coming up. It's coming. It's coming. You're doing great. I know it's hard to just sit there. All right. And here we go. Copy. And put into the chat box. Paste. And send. Okay, these are the 4 moral principles to guide triage decisions that came out in the law committee, March 2020, not so long ago. Treating people equally, either through first come, first serve, or through a lottery. That's more fair than, picking and choosing. Favoring the worst off on the basis of the rule of rescue. Triage, who's most likely, who's going to die first. 3, maximize total benefits, utilitarianism, measured either by the number of lives saved or the number of life years saved. You save 10 people who have 3 days to live, or you save 3 people who have 10 years to live. And 4, promoting and rewarding social usefulness, based on either an instrumental value for the future of society, save the doctors, that's not the rabbis, or on reciprocity, thank you, Mark, on the reciprocity for past contributions. You know what, you've done enough, you've done such good in the world, you deserve to live, including those on the front lines of fighting the COVID-19, right? The frontline workers, thank you, people who are on the front lines. So, what does the tshuva say in March 2020? Favoring the worst off would lead us to prioritize those most vulnerable, such as the elderly, the immunocompromised, and or minority groups who have historically been discriminated against in healthcare. So in March 2020, they listed elderly and immunocompromised and minority groups as the 3 groups who should come first. And now let's talk about, we're almost done. We're almost ready for the attack. What about vaccine nationalism? I never even heard that term, but it makes sense to me. What is vaccine nationalism? All right. This is countries seek to inoculate their citizens before everyone else, which leads to greater inequality of distribution, right? The rich countries come first, right? We buy it. There's only so much vaccine out there and we buy it up. Right. And then we're like, we have in some places have so much, they have nowhere place to store it. Goes bad. According to the Duke Global Health Innovation Center, there will not be enough vaccines to cover the entire world's population until 2023 or 2024. It will be 2023 or 2024 until the whole world is vaccinated. That's a long time. Now you're hearing from in America, we're hoping to get to 1 million a day. Vaccines, 1 million a day. That's the hope. But that's only America. wealthy countries are stockpiling the vaccines. We saw it right away. Countries were saying, we have this many, we got this many more. We bought it from this, this one or that one. COVAX. Okay, COVAX is an interesting thing. I just learned about it. I'm sure someone here might be able to tell me more. I learned about COVAX. What is COVAX? It's an acronym, COVAX, COVAX, a worldwide platform to support the research, development, and manufacturing of COVID-19 vaccines. As of this writing, more than 180 countries have signed a pledge to participate in this initiative, the COVAX initiative, including Canada, Israel, and much of Europe. But guess what? The United States and Russia are the largest countries in the world who so far have refused to commit to COVAX. So we are not part. Yeah, let's not get into the Paris plan. Yeah, let's stick to COVAX. We're not signed on. 180 countries, including Israel and much of Europe and Canada, have signed on working for the whole world's benefit. But United States and Russia have not signed on to this initiative for a global distribution. This initiative would help put our values into action. This is the tshuva making a moral statement. This initiative would help put our values into action and working towards a more ethical global distribution of vaccines. So yeah, I give this rabbi credit. He's not just talking about facts. He's talking about morality. Ethical distribution of COVID-19 vaccines within our country. Let's go to our country itself. The CDC, remember the law of the land is the law. Here it goes. The CDC. Oh, we're on my last page. Look at that. Okay, very exciting. The CDC has principles to follow. And they look a little something like this. Paste. 3 principles the CDC follows when it comes to distribution of the vaccine within our country. Maximize benefits and minimize harm. Sounds a little like the Hippocratic Oath. Mitigate health inequities and promote transparency. The overall goal for the CDC is to reduce severe morbidity and mortality and negative societal impact. Yeah, fix, don't hurt. And the recommendation of the National Academy of Sciences framework for equitable allocation of COVID-19 vaccine is what they're following, published in October 2020. So here it goes. I'm going to give you what the CDC is basing it on. Ethical, the National Academy of Sciences framework for equitable allocation of COVID-19 vaccine, published in October 2020. Here it goes. I'm going to give you a bunch of it. You are going to get pieces one at a time because it's just too many words. Here's our first piece. Okay, copy. We are really close to the end of my rant. Okay. All right, number 1, just in case you can't read. Okay, 4 more. No, that's it. Let me get down. Okay, ethical principles. Maximize benefit encompasses the obligation to protect and promote the public's health and its socio and economic well-being in the short and long term. Equal concern requires that every person be considered and treated as having equal dignity, worth, and value. Everyone is important. Mitigation of health inequities includes the obligation to explicitly address the higher burden of COVID-19 experienced by the populations affected most heavily, given their exposure and compounding their health inequities. All right, that's ethical principles, October 20th to October 2020, that CDC's following. What about procedural procedures? Okay, here it goes. Procedural principles. Let me give you what our country is supposed to be following. All right, the CDC, this is straight from their research. Here it goes. Procedural principles. Fairness requires engagement with the public, particularly those most affected by the pandemic, and impartial decision and making about even-handed application of allocation criteria. All right, fair. Equity, equal, fair. Transparency includes the obligation to communicate with the public openly, clearly, accurately, and straightforwardly about the allocation framework. I talked my cardiologist today. I said, well, he's like, I've got no idea. As it is being developed, deployed, and modified. And 3, evidence-based expresses the requirement to base the allocation framework, including its goal, criteria, and phases, on the best available and constantly updated scientific information and data. Okay, you are actually so close to the end right now. I can taste it. 17, I only have 2 more posts. This is the 4 risk-based criteria among our population. Let me just put this in, copy. And then hopefully someone will talk. Okay, other than me. So this is the end of how the CDC made their 3 things. 4 risk-based criteria to apply among population groups. Risk of, according to infection, acquiring infection, individuals have a higher priority to the extent that they have a greater probability of being in settings where COVID is circulating and of being exposed to a sufficient dose of the virus. Nursing homes. Risks of severe morbidity and mortality. Individuals have a higher priority to the extent that they have a greater probability of severe disease or death that they acquire infection. Nursing homes, doctors, hospitals. 4, risk of negative societal impact. Individuals have higher priority to the extent that the societal function in other individuals' lives and life would depend on them directly and would be impaired if they fell ill. Doctors, police, risk of transmitting infection to others. Individuals have a higher priority to the extent that there is a higher probability of their transmitting the infection to others. Right? They're super spreaders. And here it goes. I'm hitting the summary. So just in case you fell asleep, I'm going to put the summary of what I just said. And by the way, the summary is not what I said. All CHU vote, all laws in the conservative movement end with the summary. That's what you do when you're lazy in rabbinical school. Okay, so the CDC says there may, so Judaism, that's the CDC. So Judaism asks, the tshuva finishes up with this. What about jumping the line? There may be a desire, even by well-meaning individuals, to try and jump the line. Jewish law would forbid it. Right? The Talmud tells a story, and I'm not putting this in the chat. I use it so much. 2 people are walking through the desert. They have 1 canteen of water. Oh God, one of us is going to die. You have 3 choices. You share it. You both die. You give it to your friend. You die. You keep it, and your friend dies. You got 3 bad choices. They're all bad choices. What's the Jewish answer? The Jewish answer is you keep your water, even though your friend ran out of water, and even though he'll die, you don't get to say, well, he deserves to live more than I do. How? And the final line is, how do you know his blood is redder than your blood? Even if you think he's older or has children, he's a doctor, you don't get to decide who lives and dies. The Talmud says that 2 people in the desert, 1 jug of water, we must take care of ourselves first, but not at the potential cost of another's health or well-being. So someone says to me, hey, buddy, I got a vaccine here, but I'm taking it from someone else. That's a problem. Using one's connections, influence, or financial means to move up in the vaccine line has the potential to put other people's lives in danger, and therefore is forbidden by Jewish law. Here is the summary, okay, and then I'm going to open it up. Okay, the summary is going in a second. 12:06. Could have been worse. I've never tried to do a 10-page tshuva in 30 minutes. It's a 6-part summary, and I'm going to put it into the tshuva so you can, remember what you want to attack. Okay, post. Here we go. Summary from the beginning. The summary of this tshuva. I'm done. Taking preventative measures against the spread of COVID-19, such as wearing masks, frequently washing hands, physical distancing, are mitzvot commandments and mandated by Jewish law. 2, we reiterate the Jewish law obligates Jews to vaccinate themselves, others in their care, with medical guidance with vaccines that have proven safe track record. 2, 3, COVID-19 vaccines approved by the government and health agencies are under emergency processes are considered to be refuot bidukot, established treatments with because they were they're not. I'm not going to South America, and these are established treatments with proper medical guidance. Jews are commanded to be vaccinated against COVID-19. 4, there's only 6. Jewish institutions are permitted. Okay, so notice how it's written. Jewish institutions are permitted by Jewish law to require their employees, not commanded, to students, congregants to be vaccinated against Jewish law. Legal counsel should be consulted. Yeah, make sure you don't go to jail. Number 5. It's only 5 parts. Sorry. Okay, wait. I feel like it's 6 and it cut off something. Oh, it did. Okay, here. It only could fit this much. Here, let me fix this up. I see. Copy. I'm still done with the paper. Let me just finish 5 and 6. Paste. Passed. Okay. 5. Okay, here we go. Considering the ethical distribution of COVID-19 vaccines globally and nationally requires us to apply our Jewish moral principles of treating people equally, favoring the worse off, maximizing total societal benefit, and promoting social unity. Dean Adolfo requires us to accept the distribution priorities made by government. And finally, using personal connections, influence, or financial means to receive the COVID-19 vaccine sooner than our time allotted is forbidden. I am done with the chat. I am done babbling. I want to read you a question I got today, okay? Just because it's exactly what we just talked about. Here it goes. For your vaccine discussion, it was a text to me today. Our son, I won't say where, says he can get the vaccine for $50. Apparently, once they take the vaccines out of the freezer for the day, they need to be used that day, and there are always extras at the end of the day. Very disturbing. Some unethical medical professional entrepreneur is using these extras to vaccinate people that pay $50. Clearly, the selling is unethical. Is the buying unethical? What a great question. In the tshuva I just read, if you said that this was going to go to waste and that it was going to go down the toilet and that you're not taking it from someone who needs it because, then no, but if you take it, are you contributing to more of the selling? So it is it's a very difficult question to answer. I would probably answer, don't take it so you don't support this, schmuck. But because it should be distributed equally. But you could argue that you're not putting someone else at risk, because you got the money. But I'm not a big fan of buying organs buying vaccines. Because I think it could lead to some bad stuff. So here we go. We are now open for attacks. There are a lot of scams out there, right? Be careful. You're probably getting sugar water. Thank you, Georgia. You'll never know, right? Until it's too late. Mark, did I see your hand raised? Do you want to start off with something?
No, I mean, just so you know, this whole idea, the answer to the last point, if someone goes ahead, the problem you get into by people saying, well, it was going to go to waste.
Right.
Well, it wasn't going to go to waste. But what happens is if this entrepreneur now has figured out, well, if I save 6 of those at the end of the day, then what you're doing is you are taking it from someone else. Mm-hmm. And, the bottom line of it is if we all socially distance, use masks, do the right thing, 6 months from now, most of us will be immunized. It's a matter of just waiting.
And by the way, we do have a Jewish answer in that tshuva for that thing. Does anyone know? Well, I won't even waste your time. I'm just going to go right there. You know what the Jewish answer to that $50 guy? You should report him.
Right.
You are standing idly by the blood of your neighbor. This is illegal. This is affecting others. This is a danger, and you should report him. It's really what you should be doing.
Can I say one last thing also?
Yeah, and then in reference, I
did the research when we did the research on the swine flu thing, the H1N1 10 years ago. There was never ever an idea raised by any country, including the United States, of putting America first. Everyone is in this together. This is something created in this country in this time of America first. It's totally inappropriate and is so against everything we all believe in. We're trying to help the whole world is what we should be doing.
Thank you, Mark. I see Heidi, then Mark Diamond. All right. Heidi first.
Since mine's going to be real short, the guy who is selling these, first of all, anyone who gets approached by that should be saying, if you have these extras, then there are people who are standing in line somewhere to get those. Correct. So why aren't they be administered properly to those? There are plenty of people, especially now out there, who are waiting to get those frontliners, nursing homes, etc.
Correct.
And that's all I wanted to say. And actually, Mark was before me. Mark Diamond.
Oh, Mark Diamond, go ahead.
That's okay, Heidi. Thank you. If I may, two specific questions, details. Number 6, you're a doctor. You practice, you're a psychiatrist.
Yeah.
Everything is virtual. You never see a patient.
Right.
But because you are a doctor and you're on the list in your community, which prioritizes healthcare delivery, you are told you can get the vaccine. You never see a patient, but you're allowed to, if you will, jump the line. You're not doing it with connections. You're not using money. You're not illegal. Is that kosher? And then I have a question after.
Okay, so I've been asked this question a couple of times. I know a lot of doctors and some rabbis think they're frontline, but they're not. But the answer is this. I don't consider that jumping the line. You're in line. The question is, are you going to give your space up to someone else in line? So if it was simple, and I would not mess with your place in line. My research is, if you say, I'll wait till they'll be happy to keep moving along. I don't think if it was simple to just say, I'll move my number down to, 6 million instead of, 2 million. I would say, yeah, move down. But what you're describing is not jumping the line. Yes, if you're on a list and you're like, oh, wait, I don't deserve it as much. That goes back to the canteen of water moment. I would say that you should take it. You should not. Now, I said the same thing to my doctor today. I said, listen, I know I'm high risk. I don't really need it quickly because I'm in my bedroom 24/7. I'm not spreading much. But I said, when my time comes, I'm going to take it because we have not seen good. If you pass it up, don't worry. There's another billion people who are taking it. So I would say you don't give up your place in line. I do not consider that jumping the line. Even though, yes, you don't need it as much as, the frontline worker. There's a line, a list. You should not get off that list. We're all on the list somewhere. Don't get off it. Mark, you had a second question. Then I see Heidi's hand.
Yeah, this is, I read somewhere that somebody was complaining that
No.
That certainly not a Bethel member, but I read somewhere that somebody was complaining that a prisoner who had murdered 4 people was in jail, and he was on a high priority list because jails in some areas are being treated as long-term care. And her grandpa, who was 62, not really in the age, but had the heart and whatnot, and he couldn't get the vaccine. And that really bothered this person, that the prisoner who murdered 4 people, et cetera, et cetera. Right. What would be the response?
It's a simple response, and not everyone's going to like it. It's not. There's a reason I do this tough questions, not on a Saturday morning, but the Jewish answer would be you're not doing it for that prisoner. You're doing it for the prisoners and the people who work there and the ones who go home and give it. These are super spreading facilities. The 62-year-old grandfather should stay at home. I mean, it's very simple. Don't leave your house, put your mask, wash your hands. If you said that the 62-year-old father was working in a hospital, then he should be on a list. But that prison, and by the way, prisons were not listed originally in the very first iteration that came out. And it was one of those questions like, should we immunize, vaccinate prisoners? Oh, they don't deserve it. But these are super spreaders. And as we know, I think most of us know, it doesn't seem to only affect the stupid people. It's stupid people get it and give it to smart people. And so the answer Jewishly would be, yes, the prisoner gets it first, not because they deserve it more. They, if they were a schmagegi, there is something you saw in the list. It did say something like who did something good for society, right? In one of the lists, it was listed there. It does say if you did good for the world, you should be prioritized versus the person who doesn't do good for the world. But the prison issue is not about the prisoner, the murderer. It's about who they're spreading it to. I mean, it's very hard to socially distance in a prison. I have no doubt that Jewish law would say the prisoner first, even though they won't like that the granddaughter won't like that answer. There's no doubt. It's the good, the needs of the many outweigh the needs of the few, as I quote Spock from Star Trek, who quoted the Talmud. Heidi. Want me to help you? There you go.
Got it. I got it. Okay. So two things now that you've talked about the prisoners definitely are at high risk. Regardless, it's not our right to judge why they're there or how bad or good, because they all get released. They can rehabilitate. So they're back in society, spreading. The 62-year-old who, is not at a high risk shouldn't be preceding that. That's that comment. Back to my original one, someone who was offered it because they are either a doctor or a frontline worker, or labeled a frontline worker, or labeled a doctor, but who are not actually, they could be retired. Heck, I'm a firefighter. Does that mean I jumped the line?
No, but if you could be on a line.
Let me finish. If you are labeled as someone who was a frontline worker, who is a doctor, but is not practicing, then that, in my opinion, that right should be not acknowledged, because you shouldn't be at that priority list.
Right.
Because you're not practicing, you're not exposing. I mean, I was a firefighter. I'm always a firefighter. I could sit there and, jump on the bandwagon of the fire department, but that's wrong in my eyes. And
right. No, if you sign up, if you're on a list, I don't know how this happens because I'm not on any list. I said, am I 4B, 4F, H7? He's like, oh, my doctor's like, you should be 1B or 2A or something. I'm like, okay, I don't know what that means. And do I reach out? He says, no, they reach out to you. So I guess what I was picturing with Mark is, if someone comes to you and says you're on the list and your number is this number, because I know doctors they had a number. They said your number 2007, blah, whatever, then you're on a list. But yes, I completely agree with Heidi. You can't call and say, sign me up, and use something that really doesn't apply to you. So when Mark,
even if you're called, you are called, say Mark is called, whether he was or wasn't, and Mark, I'm using you,
Yeah, no, he brought it up. It's good.
But he's not active anymore.
Correct. But
so
if there is a list,
but he is taking away from another active person who could. So he needs to re-identify himself.
There is no doubt that some rabbis would agree with you, Heidi. There's no doubt. This one doesn't, but that I'm probably in the minority on that one, but I'm not positive because I can't ask all rabbis. But I would say that you are definitely quoting Jewish law when you say that. It definitely prioritize, just because your name by accident gets on a list. Is
a doctor going to get a phone call and be vaccinated before those who are active?
Could not speak to it. Susie, you're next.
Just an aside before you go on, Rabbi. Yeah. Heidi, I'm referring to doctors who are practicing, who are active, but just aren't seeing anybody.
Because they're purely virtual.
Yeah, and I'm not talking about retired. I'm talking about somebody who, like an endocrinologist, can see you about your diabetes virtually, but does not have to be in a room with you. And that's who I'm referring to, that kind of situation.
And I still have the same answer to it, because at this point, because it's all new and we need to get everyone vaccinated who should be.
Okay, let's Susie talk.
Right. So very interesting. Thanks for doing this. So this is from the Rabbinical Assembly. Correct. And yes, and I wonder how this will be applied in the Orthodox movement, because I know that we've had issues, measles outbreaks in heavily Orthodox areas, and so clearly there has been somewhat of a movement against vaccinating. So I wonder, is there going to be the same in this case? Are they going to? I realize even in this case it didn't mandate, as you said, that we have to require our congregants, our employees, and so forth. Like, I just sort of wonder how how we expect that might be rolled out.
Yeah. I'm not Nostradamus, but from what we've
Right.
seen out there in the world, there is a disconnect between Jewish law, even Orthodox Jewish law, and Orthodox Jews. Because if we're going to get a little political here and know that you are less likely to wear a mask or get vaccinated because you are farther on the conservative scale with a small c, and we know that Orthodox Jews, according statistically, will be more on the farther end of the conservative scale, it doesn't matter that the OU and the RCA both said you must get vaccinated. Very likely we're gonna have problems vaccinating Crown Heights and Williamsburg or whatever that place is, and we're seeing this in Israel as well. It plays the first place it plays out is in Israel and Mesharim, and then it moves to Brooklyn. So there is a disconnect. Same thing for organ donation. The Orthodox rabbis support organ donation. The Orthodox Jews don't. The Orthodox the rabbis say don't spread it, and don't. The Orthodox rabbis say don't. Gather. The Orthodox Jews do gather, so there is a disconnect between Jewish law and Jews. Not a surprise.
Implementation, right?
There is. Can you hear me?
We can hear you, Mark.
In reference to what Susie brought up and what you were just saying, the issue has been when we were having the outbreaks of measles, and also with H1N1, it was also a problem, but more so in recent years, the Orthodox community is not doing what happened there is they've been hijacked by the anti-vaccine movement.
Yes.
It's a major problem in Brooklyn and around the New York area, but it's around other parts of the country. So they are turning this into a whole political thing.
Yeah.
But as I think, Rabbi, you and I may have one day even chatted about this during service, but if Alva was on, she'd yell at me.
We don't talk during services.
But anyway, I brought something up to you, and we were talking about this, and the answer to it is there is no reason not to get immunized. And also, I'm not sure if you brought it up before, but so for all of you to be aware of this, the vaccine appears to be highly effective. Yes.
Yeah.
The vaccine, we don't know how long it will last, but it will probably almost certainly not be a lifetime thing. Number 3, by about a year from now, maybe not this coming fall, but by next year, I would expect we probably will have a combined influenza coronavirus vaccine together. For any of you who may remember 10 years ago when we did the H1N1 thing, although everyone remembers at that time there was a whole to-do, a new vaccine, another separate shot. Whether you're all aware of it or not, I hope all of you have had your flu shots this year. You all had the H1N1 vaccine. It's now part of the normal flu vaccine. So this will go in, but the last thing of importance is, even when you get the vaccine, the reason why you need to keep wearing a mask is because, yes, the vaccine can be highly effective to protect you against severe disease and against you from dying. However, we don't know yet whether you still may catch the virus, have it in your airway, and be spreading it to all around you. So just because you get the vaccine does not mean you don't wear a mask, please.
And by the way, an ER doctor and one of our congregants who moved to, he's old now, but he's a New York City ER doctor, calls me up, during some of the high point in New York, and is crying on the phone because he's the Jewish doctor, not all doctors are Jewish, and he's treating all these Orthodox Jews, in the hospital, with COVID. And he said he can't get them to, follow the rules, the CDC rules. And he's like, can you talk to them? You're a rabbi. I said, they don't think I'm a Jew. They'd rather be a rabbi. I go, but I was trying to just talk him down. He was just so frustrated. He's a nice Jewish boy who became a nice Jewish doctor in New York. And these doctors just are falling apart, treating people who, especially when you're treating people who are not, following the rules. It was very hard on him. He's doing much better now. Yeah. So good. Yes, Ron, hit me.
I have a question I've been thinking about. You had mentioned early on about the richer nations of the world have an obligation to assist those poorer nations.
Yeah.
And I guess what I'm struggling with, it's sort of like, the farmer with his fields that you should not you should leave the corners so
corner.
you have enough for your family. But we don't yet have enough for our country. Do we prioritize poorer nations at our own expense? And what about poorer areas of our country that don't have ready access to get these vaccines? How do you, I don't know.
There's no good answer. Now, again, this COVAX thing was trying to work with this globally for countries to work to help each other. Obviously, you're going to take care of yourself as well. Judaism says, do not give the shirt off your back, get them a job or whatever, but don't hurt yourself to help others. At the same time, your question about do we have responsibility to take care of those less fortunate, that is in the Tshuvot. I mean, it doesn't say hurt yourself to help the underprivileged, but it does say help the underprivileged first, which is a hard thing, Ron, because you're right. I haven't been immunized. Should I be helping someone else get immunized? And there's got to be some type of more, and maybe even a lottery is what they said, right? It shouldn't be, maybe there should be a lottery versus, it's so hard to order. But yes, we do have an obligation. This COVAX thing, was supposed to help countries figure it out. It's not like, let's give it all our stuff away to someone else, but a really tough question. And Jewishly speaking, we do have an obligation to those less fortunate. Can we hurt ourselves to do it? The Jewish answer is no. So that is a hard balance you're talking about. You're right. You can't give the shirt off your back to someone who has no shirt. Now they have a shirt and you don't. The world is no better off if you give the shirt off your back. That's another religion. Judaism would say, get them a shirt. Go buy them a shirt. You have a responsibility. Put the shirt on you and also get a shirt on someone else. Very, very good question, Ron, and not an easy answer. None of these are easy answers. It to some people, it's so clear cut. That's why there's a tshuva. And there'll be more. I think they're writing another one right now. All right, good. You really behaved today. I want to thank you so much. I know I have like 30 seconds before I have to be at some rabbi meeting. And I thank you for showing up at 11:30. I'm not planning on keeping it that way. I wrote new time, but that meant like next week it's back. Next week it'll be back to 12. Vacation's over. New Year's here. I really wish it was better than last year, but yesterday was not a good day. And thank you. But I think a lot of us can see the finish line, a bright light at the end of the tunnel. I don't care if it's 2023, 24, you feel like there's something to look forward to. So please stay safe, stay vigilant, be careful. We're open 365 days a year. So there's always somewhere to go. You can always be here every day with Beth-El, and really be careful. Follow the rules. And if you can get a vaccine, take it. But don't spread it. So Mark is right that same thing said to me is that there's this thing where you can spray it in your mouth and kill the COVID virus. And they say, but then you breathe again and it comes out again. Like, to understand, you could kill the virus, but if it's in the air, you could just keep breathing it out. So there's a real question whether you could breathe out the virus to someone else. You protect yourself and hurt others. It's like that. Those masks. Okay. 12:31. I'm late. You're wonderful. I love you. I'm stopping the recording. It's paused. Paused.